What do you hear? If your TV is on, do you have any idea what is going on by just listening? Vision provides one of our greatest methods for incidental learning, or learning through interacting with our environment. Many of us have experienced many opportunities in life where we have learned by watching. What would you do if you could not rely on that sense anymore? Low vision blindness could affect any one of us at any point in our lives. This lesson provides an introduction and overview to low vision and blindness. As we progress, begin to think about the educational implications, accommodations, and modifications that may be necessary for students with visual impairments. During the 1700s, the first school for children who were blind opened in Paris. In the 1800s, Louis-Braille created a system of braille dots for communication. However, the system was not widely accepted until after his death. In addition, schools for the blind opened in the U.S. During the 1950s and 1960s, public school classes for children with visual impairments were organized, and in the 1970s, vision training to maximize residual sight was implemented. Furthermore, IDEA required specialized services and access to public school classrooms. Two definitions exist that define the term low vision blindness: the legal definition and the federal definition. The legal definition is based on acuity and field of vision. Acuity meaning how clearly one can see, and field of vision referring to how much one can see. The federal definition, which we will focus on, states that visual impairment, including blindness, means an impairment in vision that, even with correction, adversely affects a child's educational performance. The term includes both partial sight and blindness. The federal definition includes the terms legally blind, functionally blind, and low vision. Legally blind refers to a person's visual acuity and field of vision. It is defined as a visual acuity of 20/200 or less in the person's better eye after correction, or a field of vision of 20 degrees or less. With correction means with glasses. If we provided glasses to a person and out of their best eye their vision was 20/200 or poorer, then they would be considered legally blind. However, if glasses corrected vision to better than 20/200, then the person would not be blind. Low vision indicates that some functional vision exists to be used for gaining information through written means with or without the assistance of optical, non-optical, or electronic devices, usually 20/70 or worse, with correction. A big part of the definition of low vision is whether the person can get some information from print. Functionally blind, on the other hand, is an educational description used when the primary mode of learning is through tactile or auditory means. A normal person can see about 135 degrees up and down and 160 degrees from side to side. So 20 degrees less from side to side or up to down is quite a limited field of vision. To help provide a better understanding of the notations used to describe visual acuity, the top number is the numerator and the bottom number is the denominator. The numerator tells the distance in feet between the person and the chart. The denominator indicates how different from typical vision the individual's vision is. Therefore, 20/40 vision means that a person can see a letter at 20 feet that a typically sighted person could see at 40 feet. The number on the top never changes. However, the greater the number on the bottom, the worse the vision is. Let's take a look at how the eye works. Light enters the eye through the cornea and then moves through the iris into the pupil. The light is converged by the lens and moves through the vitreous humor to focus on the retina, where the light is changed into electrical signals that are sent along the optic nerve to the occipital lobe of the brain for interpretation as visual images. There are many ways to classify visual impairments. Impairments are usually classified as refractive errors, retinal disorders, and optic nerve problems. Refractive errors are the most common vision problems. Refractive errors occur when the cornea and the lens are not in sync. You can see in this diagram where the cornea and lens are located. The eye normally creates a clear image because the cornea and the lens bend or refract incoming light rays to focus them on the retina. The retina can be thought of as a mirror in one sense because it provides the picture that sends the image to the brain. In order to get a clear picture on that retina, the cornea and lens need to be in sync. When the cornea bends, the lens needs to bend based on the amount of light that is coming in. Refractive errors include myopia, hyperopia, and astigmatism. At times, light focuses before it reaches the back of the eye. When this happens, myopia or nearsightedness occurs. On the other hand, when light does not focus before it reaches the back of the eye, hyperopia or farsightedness occurs. Astigmatisms result when one or more surfaces of the cornea or lens are not spherical, but rather are cylindrical. All of these conditions cause impairments to varying degrees, and Table 12.1 and 12.2 in your book provide more detail on eye functioning and visual impairments. The second type of vision problem that can result is retinal disorders. Retinal disorders occur when part of the visual field is blocked. The retina is a layer of tissue in the back of the eye. Think of the retina as a mirror that's going to send that visual information to the brain. If part of the mirror is painted, then it is going to eliminate information from the visual field. The retina sends images to the brain through nerve impulses, and if part of the retina is damaged, those nerve impulses can't send that information to the brain. This is what causes the field of vision to be limited. The macula is also located in the center of the retina. The macula provides the sharp vision needed for reading, driving, and seeing detail. Macular degeneration results from degeneration of the macula and causes blind spots. The optic nerve is also called the cranial nerve and is the piece of the body that transmits information from the retina to the brain. Your eyes can work perfectly well, but if the optic nerve does not transmit that information, you will not be able to see. Damage to the optic nerve typically causes permanent and severe loss of vision. The optic nerve is not always completely damaged, so the visual field loss depends on what part of the optic nerve is damaged. The optic nerve can be damaged by a variety of diseases, one of which is glaucoma. Low vision blindness is a low incidence disability. That means that there is not a large percentage of students that require special education services under this category. Approximately 2.8% of the school-age population require services due to low vision or blindness. During the 2008-2009 school year, about 26,000 children received special education services for low vision blindness. Visual impairments have two primary causes. They can be congenital or adventitious. Congenital vision impairments occur at birth or before vision memories have been established, while adventitious vision impairments are acquired impairments. Specific causes of visual impairments can also be due to problems associated with various parts of the eye. Cornea damage or infection may limit acuity and visual field. Glaucoma caused by excessive pressure in the eye, which damages the optic nerve, results in restricted visual fields, a cloudy lens, and can be painful. There can also be a malformation in the iris that causes light sensitivity. Cataracts, which affects the lens of the eye, can impair vision, color, and also have light sensitivity. Other causes of visual impairments include infection or disease of the vitreous body that blurs or distorts vision. Impairments to the retina, rod cells, and cone cells can also cause blurred vision, photosensitivity, and difficulty with color. Most visual impairments are genetic, but some can be prevented and/or controlled. Prenatal care, early detection through vision screenings, and eye safety are all preventative measures that can be taken to help prevent visual impairments. Prenatal care can assist with preventing eye conditions that are secondary to sexually transmitted diseases, prematurity, or other hereditary problems. Vision screenings and regular eye examinations can also help detect vision impairments early on. Furthermore, preventative eye safety such as understanding dangers, identifying and correcting hazards, and using care can help reduce visual-related impairments.